Alright, so in this video we are going to be talking about the muscles in the gluteal region, the muscle fibers, and then actions that go along with this. So I already have it brought up. I'm going to go layer by layer for each muscles that we're going to go over. So I already have it brought up to the 7th layer, and we'll start with the first one. So it'll be right here. This is the gluteus maximus muscle. The origin for this is the posterior ilium, and then the posterior gluteal line, and then the posterior sacrum and coccyx. The insertion is the tubercle of the iliotibial tract of the tibia. The direction of the muscle fibers is, if you can see right here, is that it's infralateral, so it goes downwards and then towards the side. This muscle fiber allows for extension and laterally rotates and abducts the thigh at the hip joint. An action that is made possible because of this muscle is if you're sitting and then just standing up, or if you're running. This action helps that out. Okay, and then the second muscle of the 7th layer that we're going to go over is over here. Maneuver it this way. So this one is the tensor fascia muscle of the left side. The origin for this is the anterior superior iliac spine, and then the anterior outer iliac crest. The insertion is a tubercle of the iliotibial tract of the tibia, and then the direction of this muscle, if you can see, maneuver it this way, is that it's inferior and downward, and then it goes slightly medial. The action that is allowed for by the muscle fibers and the muscle is that it assists in medial rotation, abduction, and flexion of the thigh. So an action that we do every day that can be done because this muscle is walking. So as we're walking and then striding our leg, extending it forward, and then planting. Okay, and then we're going to go into the 6th layer of muscles right here. And we will start with this one. So this is the gluteus medius muscle. The origin for this is the ilium area between the anterior and posterior gluteus. The insertion for this muscle is the lateral aspect of the greater trochanter of the femur. The muscle fibers, if we look at it right there, is that it also goes infralaterally, so it's downward and then to the side. The actions that are be able to be done with this is that it immediately rotates and abducts the thigh at the hip joint. Some everyday actions that or occupations that we engage in that are allowed for by this muscle is walking and running. Okay, now we're going to go into the 5th layer muscles. So we will start right here. So this is the gluteus minimus muscle. The origin for this is the area of the ilium between the anterior and inferior gluteal lines, and then the insertion is the anterior lateral aspect of the greater trochanter of the femur. The muscle fiber directions, let me turn it this way, is that it goes infralaterally, so downwards and outwards to the side. So the actions for this is immediately rotates and then abducts the thigh at the hip joint, just like the other muscles we have talked about. An everyday action that can be done by this, it's different from running and walking, is balancing on one leg or moving sideways. So if you for instance, if you were working out and you did a lateral lunge, that muscle is helping with that action. Okay, and then the next muscle is going to be right here. Turn it sideways so you can see. So this is the piriformis muscle. The origin is the pelvic surface of the sacrum and then the sacro tuberous ligament. So if you can see right here, origin right there. And then the insertion is the superior border of the greater trochanter of the femur, just like that. The muscle fibers is that it goes inframedially, so that's downwards and outwards. The action for this is that it laterally rotates and then transversely abducts the thigh at the hip joint. Some everyday occupations that can be done because of this is walking and pivoting. Okay, so now we are going to move into the fourth layer of muscles. We could start with this one. This is the coccygeus muscle. The origin for this, turn it this way, is the ischial spine. The insertion for this is the anterior lateral aspect of the sacrum and coccyx. So you can see right there. And then the muscle fibers, if you turn it this way, is that it's posterior medial. So that means it's backwards and down. So as you can see, it goes backwards and then downwards. The action for this is that it just provides structural support to the pelvic structure. And then the everyday action that it does is that it works to control urination and defecation. Okay, so I went ahead and zoomed in a bit so we could go into the other muscles. We will start with this one right here. This is the superior gemellus muscle of the left side. The insertion for this is the ischial spine. The origin is the ischial spine. The insertion is the medial aspect of the greater trochanter of the femur. The muscle fiber direction is that it goes laterally and downward. So it goes laterally and then down. The action for this is that it laterally rotates and transversely abducts the thigh at the hip joint. Some everyday actions that can be done because this muscle is moving your leg outward. So if you were trying to get out of the car, you would put your leg outward first and then stepped up. Okay, and then now we're going to get into the third layer muscles. Alright, so now we're going to do the third layer. So we'll start with this one right here. This is the iliococcygeus muscle. The origin is going to be the ischial spine and tendinous arch of the levator ani. The insertion is the coccyx and the iliococcygeal raphe. The muscle fiber is going to be, the direction of it is posterior medially. So as you can see, posterior and then medially. The action for this is that it provides structure to the pelvic structure and then fecal continence. So the everyday action would be maintaining tonic contraction at rest. And then we're going to do another muscle. We're going to do this one right here. This is the pubococcygeus muscle. The origin for this is the posterior aspect of the body of the pubis and then the arch of the levator ani. The insertion is the coccyx, the pubococcygeus tendon, the perineal body, and then the walls of the vagina and then prostate in males. The muscle fiber direction, go down this way, you'll be able to see, is that it's posteriorly downward. So it goes posterior and then down right there. And then medially too, since it's going towards the midline. The action for this is that it provides structural support and then urinary and fecal continence. Okay, so the next one is going to be this one right here. So this is the deep transverse perineal muscle. The origin for this is the internal surface of the ramus and the ischium. The insertion is the perineal body. If you look at the muscle fibers right there, they go transverse and medially. The action for this muscle is that it just stabilizes the perineal body and then it provides structural support to the adjacent pelvic structure. And yep. Next one is going to be this one right here. This is the superficial transverse perineal muscle. The insertion, the origin is the ischial tuberosity and then the ramus and the ischium. The insertion is the perineal body. The direction of the muscle fibers is that it goes transversely, so it goes across. The action is that it stabilizes the perineal body as well, and then it provides structural support to the pelvic and then the perineal. Then as you can see, there's a lot more muscles that are the intrinsic muscles of this area that help help the reproduction organs of both males and females. We just will not be going over them today. So this one, this finger, that's a ligament. And then